Okay, good day. I am Dr. Glenn Mangali, and I'll be discussing one of our topics in research entitled Validity and Reliability. So give me some time to share my screen to everyone. So again, good day. I am Dr. Glenn Mangali, and I'll be discussing about validity and reliability. So before we proceed, validity and reliability are crucial concepts in the context of research instruments, which include tools like survey, tests, um, questionnaire, and other data. Validity refers to the extent to which the research instrument measure what it is intended to measure. It is also addresses whether the result of the instrument accurately reflect the concept or variable being studied. Reliability, on the other hand, refers to the consistency of a research instrument. A reliable instrument yields the same results upon repeated trials under consistent condition. So for this session, we'll talk about concept of validity. We will be explaining the different types of validity and describe the concept of reliability. So when you talk about validation in research, we are referring to the instrument. An instrument is a general term that reaches or that the researchers use for a measurement of a device. Now, it could be a survey, test questionnaire, aid memoir, or other interview guide. Validation involves collecting and analyzing data to assess the accuracy of an instrument. So when a test or a measurement is validated, it simply means that the researcher has come to an opinion that an instrument measure what is assigned to measure. In other words, validity is no more than an expert opinion. Now, the concept of validity answer the question, are we measuring what we think we are measuring? It is defined as a degree to which the researcher has measured what he has to measure. It also answered the question, what and who decides whether the instrument is measuring what it's supposed to measure? And how can it be established that an instrument is measuring what it's supposed to measure? So when you talk about validity, there are four areas that we will be covering: criterion validity, phase validity, content validity, and construct validity. Let's start with the types of validity, particularly on content, construct, and criterion. Content validity ensures that the instrument covers all aspects of the concept. Construct validity confirms that the instrument truly measured the theoretical construct it is supposed to measure. And criterion validity examines how well one measure predicts an outcomes based on another measure. It could be predictive validity or concurrent validity. Now, validity ensures that the conclusion drawn from the research are accurate and trustworthy. If an instrument is not valid, any inferences made from its data may be flawed, leading to incorrect conclusion or ineffective intervention. There are also types of reliability. It could be test-retest reliability, which focus on the consistency of result when the instrument is administered to the same group at different times. It could be inter-rater reliability, where the agreement between different observers or rater are using the same instrument. And internal consistency, when the consistency of result across item within the instrument. Example of that is when you do Cronbach's alpha. Now, reliability ensures that the data collected is stable and consistent, making the result reproducible and dependable. Without reliable or reliability, the data may be inconsistent, leading to unreliable findings that cannot be replicated or trusted. Now, you might be asking, why do we need to consider the concept of validity and reliability? Now, there are three reasons why we are doing such. Number one, we want to ensure that our decision is valid and reliable, and we want to ensure that the decision is based on research findings are informed and accurate. Another thing is what you call generalizability, meaning to say high validity and reliability increase the likelihood that the findings can be generalized to other contexts. Next is quality of research. The overall quality and credibility of research depend on the use of instruments that are both valid and reliable, as they directly impact the accuracy and consistency of the data collected. Another concept that we have to remember is called the face validity. Face validity is establishment of a logical link between the questions and objectives of the study. And it is as a subjective judgment on the operationalization of a construct. So face validity is a degree to which a measure appears to be related to a specific construct in the judgment of a non-expert, such as test takers and representatives of the legal system. Face validity refers to the extent to which a research instrument appears on the surface to measure what is supposed to measure. So unlike other forms of validity that rely on a statistical analysis, face validity is more about the instrument's superficial appearance and whether it seems appropriate to those using or reviewing it. So there are different characteristics of a face validity. Number one is what you call the subjective judgment. It is often based on the subjective judgment of researchers, experts, or even participants. If the instrument seems reasonable and appropriate for measuring the concept, it is said to have high face validity. Another thing is what you call the first impression. It is essentially about the first impression the instrument gives, whether it looks like it's measure what intended construct is. And third is not scientifically rigorous. Face validity does not provide rigorous evidence that the instrument actually measures a concept. It only suggests that it appears to do so. So what are some examples of face validity? Number one, survey. Suppose a survey is assigned to measure job satisfaction if the questions ask about various aspects of job satisfaction, excuse me, such as work environment, relationship with colleagues, and salary, the survey would have high face validity because the question seemed directly related to job satisfaction. Second, psychological academic tests. Consider a math test meant to assess the basic arithmetic skills. If the test contains problems like addition, subtraction, multiplication, and division, it would have high face validity because it obviously looked like it's testing arithmetic skills. Third is psychological assessment. A questionnaire designed to measure anxiety might include questions about feeling nervous, experiencing worry, or having trouble relaxing. If these questions appear to align with common understandings of anxiety, then the instrument would have high face validity. Next, what is the importance of face validity? Number one, acceptance. Well, participants' acceptance. A high face validity can enhance acceptance of the instrument by participants, as they are more likely to engage seriously with a tool that seems appropriate and relevant. Another thing is first step. While face validity alone is not sufficient to establish the overall validity of an instrument, it is often a good starting point. Instrument with poor face validity may need to be reevaluated or revised before more rigorous forms of validity testing are conducted. What are the limitations of face validity? Number one, subjective nature. Since face validity is subjective, it can be influenced by the biases or perception of those evaluating the instrument. Second, not sufficient for rigorous research. Face validity alone does not guarantee that the instrument truly measures the intended construct. It must be supported by other types of validity. Example of that would be construct or content validity for the researcher to be or for the research to be scientifically sound. So these are example of the normal checklist that I use when I evaluate an instrument or whenever I ask a person to evaluate my instrument. So normally in the face validation, you look at the format, like the design, the printing, the quality of the paper, the layout, its attractiveness and uniformity and the like. Another area of face validation is the language and style. The language used and the style is appropriate to the learners or to the participants or to the employer, and whether the language is also consistent. Sometimes we also include content, but there's a separate discussion on the content validity. So this is another example of a tool for validity. And sometimes the researcher would ask the validator to evaluate every sentence in the questionnaire or in the instrument that he or she developed so that it can ensure the cohesiveness and validity of the instrument that he will be using. And even if you're doing a qualitative research, the kind of question we ask to our participants are also being validated by the experts. This is an example of a kind of instrument that are qualitative in nature, wherein the validators would evaluate every question in a particular construct or theme, whether it is aligned or not aligned. Another thing is that you need to ensure that there are some data or personal details that you will be getting, because perhaps these are proof as to whether your instrument can be used by other people, or you may also use the data or the information in order to understand further the result of the study later on. So other examples are this, no, there's a statement and then the participant will check that, and then the validator would ensure whether the participant or participants can answer that kind of instrument. So these are another example. Notice here that I included the gender and the sensitivity of the instrument by adding LGBTQ and the like, no, and many other aspects that can be included as part of your questionnaire. And at the end of your validation procedure is you will be asking the validator to give you a certification. There are some cases wherein an institution provide a template for a certification of validation. But this is an example of a certification that you can use as your guide, wherein you include the name of the title of the paper, the name of the researcher, and what is or are the instrument I have validated, or what are the instrument that the validators validate, no, in that process. Then the person has to write his complete name and a basic signature. For qualitative, I even check the informed consent, no, and the protection of the participant. So this is an example of how I write the informed consent. There's a short introduction. What is a study all about? How will you engage in the qualitative research undertakings and the like? So even the protection of the confidentiality and the participants' rights are also included. This is an example of an instrument validation service form. There are some institutions wherein they are the office is the one providing validator to the students or to the researcher, but they have to pay it, no? Because whenever a validator spend time checking your instrument, they are also giving you their time, and most of them are experts. So because we're getting their time, that's why we give them honorarium. Let's continue. Construct validity refers to the extent to which a research instrument accurately measures the theoretical construct or concept it is intended to measure. And this type of validity is concerned with how well the instrument reflects the true nature of the underlying concept and whether it behaves as expected based on the theoretical prediction. So construct validity refers to the extent to which a research instrument accurately measures the theoretical construct or concept it is intended to measure. And this type of validity is concerned with how well the instrument reflects the true nature of the underlying concepts and whether it behaves as expected based on the theoretical predictions. So there are characteristics of construct validity. Number one, you need to ensure that there is a theoretical foundation. Construct validity is grounded in a theory behind the construct being measured, and the instrument should align with the theoretical understanding of the construct. Second is relationship with other variables. Construct validity often involves examining the relationship between the instrument and other related or unrelated variables. The instrument should correlate with the variables that are connected to its theory and should relate to it. It's called convergent validity. If it's not correlated with variable, it shouldn't relate to, and you can say it's called discriminant validity. Another thing is what you call the complexity. Construct validity is often more complex established compared to other forms of validity because it requires a deep understanding of the construct and its relationship with other variables. A while ago, I have mentioned two kinds of construct validity. The first one is called convergent validity. This occurs when the instrument correlates well with other measures of the same construct or related constructs. Second is what you call discriminant validity. This occurs when the instrument does not correlate with measurements or measures of different and unrelated constructs. So this is what I have mentioned a while ago. Characteristics of construct validity, the three of them, and the types of construct validity. Now, what are the examples of construct validity? Number one, let's have psychological testing. So consider a psychological test designed to measure self-esteem. To establish construct validity, researchers might examine whether the test correlates with other measures of self-esteem, and that is convergent validity. Additionally, they might check that the test does not correlate with unrelated construct, such as intelligence, and that is discriminant validity. If the test correlates strongly with other self-esteem measure, but not with intelligence tests, it would demonstrate good construct validity. In educational setting, suppose a test is developed to measure mathematical reasoning ability. The test should correlate with other measures of mathematical reasoning or related skills, like for example, problem-solving ability. If students who score high on the test are also perform well in math courses and other reasoning tasks, this would support the construct validity of the test. Conversely, if the test does not correlate with unrelated subjects like verbal reasoning, it would further support its construct validity. And third, health research. Imagine a survey designed to measure the construct of health-related quality of life. To establish construct validity, researchers might check whether the survey correlates with other established measures of quality life, physical health, and mental health. They would also ensure that the survey does not correlate with unrelated constructs like economic status unless theoretically expected. And that is what you call discriminant validity. So what is the importance of construct validity? Number one, construct validity ensures that the instrument accurately reflects the theoretical concept it is intended to measure, making the research findings more theoretically sound. Second, it would have high construct validity provides confidence that the instrument measures a construct as intended, leading to more accurate and credible research conclusion. Now, construct validity helps in the correct interpretation of the data by confirming that the instrument behaves as expected in relation to other variables. So in order to ensure that the instrument is valid, we need to establish construct validity in three ways. Number one, factor analysis, a statistical method used to identify the underlying structure of the construct and verify that the items in the instrument group together as expected based on the theory. Second is hypothesis testing. Researchers might test a specific hypothesis based on the theory to see if the instrument behaves as predicted. For example, if a construct is supposed to increase with age, the instrument should reflect the increase in older population. And finally, correlation with related constructs. Comparing the instrument's result with those of other instrument measuring similar construct can help establish convergent validity. Lack of correlation with unrelated construct establishes discriminant validity. On the other hand, there are also limitations. No? Example is what you call complex and ongoing study. No? Construct validity is not established in a single step. It is an ongoing process that evolves as more research is conducted and more evidence is gathered. Construct validity also depends heavily on the clarity and accuracy of the underlying theory. If the theory is flawed, the construct validity of the instrument may be compromised. Criterion validity, on the other hand, refers to the extent to which the result of a research instrument are consistent with external criterion or a benchmark that represents a concept being measured. It assesses how well one measure predicts or correlates with a related outcome. Criterion validity is typically divided into three types. It could be predictive validity, concurrent validity, and postdictive validity. So when you talk about predictive validity, it refers to the extent to which a test or instrument can predict future outcomes or behaviors. It is determined by comparing the instrument's result with the outcomes that occur at a later time. For example, a college entrance exam like the SAT is used to predict students' future academic success in college. If higher scores on the SAT are associated with the better college grades, then the test has high predictive ability. Second, concurrent validity. Concurrent validity refers to the extent to which the result of a test or instrument correlate with other measure that is taken at the same time. It assesses whether the instrument aligns with existing measure or criterion that is already considered valid. For example, a new depression screening tool is administered to patients at the same time as an established, validated depression questionnaire. If the new tool yields similar results to the established one, it has high concurrent validity. And lastly, postdictive validity. Postdictive validity refers to the extent to which a test or instrument can explain past behaviors or outcomes. It involves correlating the instrument result with past events or outcomes. For example, a psychological assessment designed to measure impulsibility might be validated by its ability to correlate with past incidents or risky behavior, such as previous accidents or financial decision. So how can we compare and contrast the two or the three based on time orientation and its uses? So predictive validity focuses on the future outcomes. It is forward-looking, assessing how well the instrument predicts what will happen. Concurrent validity focuses on the present, examining how well the instrument correlates with other measures taken at the same time. And postdictive validity focuses on the past outcomes, looking backward to see how well the instrument explained previous events. Now, in the area of uses, predictive validity, it is commonly used in educational and employment setting where the goal is to predict future performance, such as entrance exam or job applicants tests. Concurrent validity often used when developing new instrument or tools, ensuring they align with existing validated measures in the present. And postdictive validity is used in retrospective studies, particularly in psychological research, where researchers aim to understand past behavior or events. So what are some examples of this? For example, on predictive validity, a company's hiring test predicts future job performance, where test scores are compared with employees' performance reviews several months later. Concurrent validity. An example, a new blood pressure monitor is validated by comparing its reading with those from the clinically approved monitor at the same time. And in post-dictive validity, a criminal behavior assessment tool is validated by its ability to correlate with an individual's prior history of criminal activity. So to sum up, predictive validity is future-oriented, assessing the ability of an instrument to forecast future outcomes. Concurrent validity is present-oriented, measuring the correlation between an instrument and existing validated criterion at the same time. And post-dictive validity is past-oriented, focusing on how well an instrument can explain past behaviors or outcomes. All three types of criterion validity are important in different research and practical contexts, depending on whether the goal is to predict the behavior, validate new tool against current standard, or explain past events. Now, let's proceed to content validity. Content validity is defined as a degree to which items in an instrument reflect the content to which the instrument will be generalized. It also refers to the extent to which a research instrument adequately covers the entire domain or content area it is intended to measure. It assesses whether the instrument includes all the relevant items and aspects of the concept being studied, measuring that nothing important is left out and nothing irrelevant is included. So, what are the characteristics of content validity? Number one is comprehensive coverage. The instrument should comprehensively cover all aspects of the construct it aims to measure. Second is expert's judgment. The validity is often evaluated by experts in the field who can judge whether the items included in the instrument represent the entire content area adequately. Next is relevance. Each item in the instrument should be directly related to the concept being measured. So how can we use that concept in the different field? Let's start with education. Suppose a teacher develops a final exam for a history course that covers topics like Renaissance, Industrial Revolution, and World War II. If the exam includes questions that adequately cover each of these topics, it would have high content validity. However, if the exam only focuses on the Renaissance and ignores the other topics, it would have low content validity. Second, on psychological testing. Imagine a psychological test designed to measure depression. The test should include items that assess various symptoms of depression, such as mood, energy levels, sleep patterns, and feelings of worthlessness. If the test covers all these areas, it would have high content validity. If it only includes questions about mood but neglects other important symptoms, it would lack content validity. And job performance. Consider a performance evaluation tool used in a company to assess employees' job performance. If the tool evaluates all relevant aspects of the job, such as technical skills, teamwork, communication, and problem solving, it would have high content validity. If it only assesses technical skills but ignores other important aspects, the tool would have low content validity. What is the importance of content validity? Number one, it ensures relevance. Content validity ensures that the instrument measures what it's supposed to measure by covering all relevant aspects of the concept. This makes the result more meaningful and useful. It also reduces bias. By covering the entire content area, content validity reduces the risk of bias that might occur if only certain aspects are emphasized while others are neglected. Next is improves credibility. Instruments with high content validity are more credible and trusted by researchers, practitioners, and stakeholders as they are seen more comprehensive and representative of the concept being studied. So how content validity is established? Number one, expert review. A panel of experts in the field reviews the instrument and assesses whether the items are representative of the entire content area. They may suggest adding, modifying, or removing items to improve content validity. Second is the CVR, Content validity ratio is a statistical measure used in some cases to quantify content validity based on experts' judgment. It helps determine whether an item is essential to the construct being measured. So although we are considering all the objectivity, there's still limitation whenever you do content validity. Number one is the subjective nature, like face-to-face validity or face validity. Content validity relies on subjective judgment, even though those judgments are typically made by experts. Next is time consuming. Establishing content validity can be time consuming as it requires careful consideration of all aspects of the construct and often involves multiple rounds of experts review. Next is the area of construct validity, particularly on discriminant and convergent validity. Discriminant validity and convergent validity are two key aspects of construct validity, which together help demonstrate that a research instrument accurately measures the intended construct and not something else. Convergent validity refers to the extent to which a measure correlates positively with other measures of the same or related constructs. It demonstrates that the different instruments that are theoretically supposed to measure the same construct produce similar results. So suppose researchers are developing a new self-esteem questionnaire, which I mentioned a while ago. To establish convergent validity, they might administer their new questionnaire alongside an existing well-validated self-esteem measure to the same group of people. If the scores on the new questionnaire correlate highly with the scores of the established measure, this indicates strong convergent validity. Another example is in psychology, where both self-report measure of anxiety and physiological measure of anxiety, like heart rate or cortisol level, are expected to correlate because they both measure aspects of anxiety. A high correlation between this measure would demonstrate convergent validity. Discriminant validity is also known as divergent validity, which refers to the extent to which a measure does not correlate with measures of different unrelated constructs. It shows that the instrument is distinct and not simply measuring something else. So for example, using the same self-esteem questionnaire to establish a discriminant validity, researchers would compare the self-esteem score with the measure of unrelated construct, such as IQ. If the self-esteem questionnaire does not correlate strongly with IQ, this would suggest good discriminant validity, as it confirms that the self-esteem questionnaire is not measuring intelligence. Another example is when assessing a new measure of depression. Researchers would test its correlation with the measure of anxiety. Since depression and anxiety, while related, are distinct constructs, the correlation should not be too high. A low correlation between the depression measure and unrelated construct like satisfaction would demonstrate discriminant validity. So what is the purpose, no? And the differences and the uniqueness of them? So that will allow us to understand the significance of reliability. Reliability is if a research tool is consistent and stable, hence predictable and accurate. The greater the degree of consistency, the stability in a research instrument, the greater the reliability. The scale or test is reliable to the extent that repeat measurements made by it under constant condition will give the same results. Reliability is a degree of accuracy or precision in the measurement made by a research instrument. So to sum up, there are three concepts that we need to understand to further analyze the difference between validity and reliability. What does it tell you? Reliability is the extent to which the results can be reproduced when the research is repeated under the same condition. Validity is the extent to which the result really measure what they're supposed to measure. In the context of how is it assessed? By checking the consistency of results across time, across different observer, and across parts of the test itself. Validity is by checking how well the results correspond to established theories and other measures of the same concept. And finally, how do they relate? A reliable instrument is not always valid. The results might be reproducible, but they are not necessarily correct. But in the area of validity, a valid measurement is generally reliable. If a test produces accurate result, they should be reproducible. So that's the end of my presentation. Thank you for listening.